confess. Amen? For who can stop the Lord Almighty? Who can stop the Lord Almighty? Who can stop the Lord Almighty? No one. Who can stop? Sing it over the battle. Yeah, that's it. Who can stop the Lord? There is no one who can stop the Lord Almighty. Who can stop the Lord? Yeah. Our God is the Lion of Judah. He's roaring with power and fighting our battles, and every knee will bow before Him. Our God is the Lamb that was slain for the sins of the world. His blood breaks the chains, and every knee will bow before the Lion and the Lamb. Every knee will bow before Him. Yeah! Every knee will bow. Some confess.
Good evening, viewers, and a happy new month. Thanks be to Almighty God for His unfailing love and abundant mercies. Just as the month of May came without disruption, so also shall your blessings come without limitations in Jesus' mighty name. You are welcome to Verses of Gold. This is Balance Bridge 6. And we thank you for joining us. We thank you for your likes, for your comments, and for always sticking to this page. Thank you so very much. Today's topic is an interesting one. We will be discussing one very important issue that affects women globally. However, its rate of increase is very high in the developing nations than the developed world. The topic of discussion for today is Vesico Vaginal Fistula, VVF. The ailment is not new, as many of us might have heard about it, or we have even seen people who are living with this ailment. But if the term is new to you, don't bother, don't worry, we got you covered this evening. We have professionals in our midst who educate us more on this topic. Introducing from my left is Dr. Matu Oje-Tokun, hope I got it right, from Obstetric Gynecology Department and IBB Specialist Hospital in the city of Mina. And on my right is my sister Grace Johnson. She is also a trained and qualified ICU nurse from same IBB Specialist Hospital, Mina. You are welcome, ma'am. In most society in the world, in the developing country, women are often seen as vulnerable gender group. The devastating and humiliating effect of this ill health, like vesico vaginal fistula, further makes them more vulnerable in this society. Women who suffer this ill health are often divorced and abandoned by their spouse and stigmatized, thus making them depressed and traumatized. They are also ostracized from their communities. All this punctures their dignity and makes them lose their confidence of enjoying quality and a balanced life. So, Dr. Matthew, we want to know more about this ill health. that has ravaged the lives of many women across the globe. What is vesico vaginal fistula?
Thank you. Good evening, viewers. Vesico vaginal fistula, as the name implies, it's a combination of 3 words. And I will try to explain each word so that we get the real meaning of what we're about to be discussing tonight. Vesico in medicine simply means bladder. Vagina is the private part of women. While fistula simply means an abnormal connection between 2 organs.
Okay.
So let me just keep it as that for now.
All right. You say vesico vaginal fistula is the connection between the bladder and the vagina. That is what you just said. Okay, what are the types? Do we have types of fistula?
Yes, we have types of fistula. But before I talk about the type of fistula we have, I want to quickly say here that in gynecology, we have some common fistulas, and they're just vesicovaginal fistula, which is the commonest fistula. We also have rectovaginal fistula. Recto simply means rectum. That is where every normal human being defecates.
Okay.
That is where shit comes out. Also, we have another one in gynecology. We call it uterovaginal fistula. Uterovaginal fistula simply means the ureter is connected also to the vagina. And as we know, ureter simply means it's like a pipe that brings out urine through the bladder. So if there is abnormal connection between the ureter also, we call them uterovaginal fistula. So those are the common 3 fistula that we see in gynecology. However, there are other fistulas. We have a lot of them. I'll just mention a few.
Okay.
We have enterocutaneous fistula.
Wow.
That one is not too common in obstetrics and gynecology. We also have other fistula like enterovaginal fistula. We have enterovaginal fistula. Let me simply just explain those ones so that people will not be confused. Entero simply means intestine.
Okay.
When intestine is connected to the uterus, which is the womb, that is enterouterine fistula. So there are lots of fistula, but like it was introduced tonight, we'll just focus on vesicovaginal fistula.
Okay, what you've just said now, if I'm to be on the same page with you, is that fistula can happen in any of these organs, like the intestine, the bladder, the uterus, the rectum. So fistula can happen when there is an abnormal connection between this. All right, thank you. And what are the causes of this fistula?
Okay. We actually have a lot of causes also. But like we all know, time is not our friend. So I'll just mention but few. The commonest cause of fistula in obstetric is prolonged obstructed labor.
Okay, prolonged obstructed labor.
Yes, for the benefit of viewers, I know that many people will be thinking, what is prolonged obstructed labor? In some cases, like before I came, that was about just 3 hours ago. A woman has been in labor for more than 48 hours.
Okay.
And everybody, they were just wondering, this service is good, so what is happening that this baby is not coming out? So the simple reason is that there is something we call cephalopelvic disproportion. Cephalo means head.
Head, okay.
Pelvic is the birth canal. Disproportion, that means the head is bigger than the birth canal.
Okay.
So because of that simple reason, the baby is fine, the pelvis of the mother is fine, but because the head is bigger, you couldn't come out through the birth canal. So that is the commonest one that we see. But there are lots of other causes of fistula. I will just run through them. One of the Other cause of fistula that we see in this environment is rupture uterus. Rupture uterus simply means, uterus means womb. Every woman has a womb. So that is where baby grows before it comes out.
Yeah.
So, but you'll be wondering what could just make the uterus rupture. In our society, we see a lot of things, especially some of us that work in the obstetrics and gynecology department. We've seen a lot of women that they will tell you they don't want to go to the hospital. They prefer to deliver at home.
Or these maternity homes.
Yes.
Or even traditional birth attendants.
Yes, we have a lot of traditional birth attendants. So some of them will move to the unskilled, untrained personnel. And some of them believe that once you just give, there are some drugs that once you give, contraction that will bring the baby out.
It will enhance it. Okay.
So they will just infuse them with those kind of drugs. And before you know, the uterus can rupture. Some not only infusing with drugs, some, if the contraction is very, very strong. We've seen a lot of rupture uterus like that.
So please, you said when the contraction is very strong.
Very strong.
And we have cases when the contractions is not,
Yes.
is low.
As a matter of fact, the instance I gave earlier, that they will move to some unskilled personnel and they will infuse them. There is this drug that causes strong contraction. We call it oxytocin. The reason why most of the unskilled personnel infuse them with oxytocin, they believe that the contraction is not good. They say, this contraction is
low.
so weak. We call it weak.
Weak,
They will say
okay?
this contraction is weak. Let's give you this thing to make it come out. You know, God in His infinite mercy, a lot of them have been doing it. And in some cases, they will infuse them, contraction will be so strong, the woman is screaming, and she will still deliver safely. But not everybody will be lucky to experience that. So some, it can make the uterus to rupture.
Okay.
Another thing that causes vesico-vaginal fistula is through medical personnel. Let me say through their mistakes. Like for instance, if you're operating a woman during CS, that is the reason why most of the time you see us, if you're going for CS, the first thing we do is to pass a pipe that will be draining the bladder of the woman.
Okay.
In fact, I had one experience recently. They rushed the woman from Paiko. So immediately they came, we called, she was seriously bleeding. Before they came, the baby had died. And we got no option but to go and operate. So immediately I got to the theater. We were rushing because she was seriously bleeding. She could bleed to death. So we got to the theater. I had even scrubbed. To cut the woman, I just remembered that we've not passed catheter.
Okay.
And I told the people in the theater, I said, I will not operate this woman without passing catheter. But because she has been in labor for a very, very long time, the head of the baby has already compressed
On the bladder.
the bladder. And I will tell us the anatomy, the relation between the bladder, the womb, and the rectum. So it has already compressed the bladder. So they try all the cool.
To
The
insert.
head couldn't allow
Give
them
way.
to pass the catheter. Then me, I insisted, because from experience, I knew that it could cause a serious problem. I insisted I would not operate.
And the kind of the serious problem it can cause is VVF.
Yes, that's what I want to explain. It can cause VVF. Then, because the bladder, uterus, and rectum, they are connected anatomically. So, one of the nurse in the theater just told me, he said, Doctor, which one do you prefer? A dead woman or the bladder? I just thought this is a common sense, truly. So I said, okay, let's operate. Immediately I delivered the baby, I just saw urine everywhere. Guess what? The bladder had ruptured.
Shot. Wow.
Because the bladder was already distended with urine. The head of the baby was compressing on the distended bladder. Of course, you could guess why. So those kind of women, if not that it happened in the hospital, of course, vesico-vaginal fistula will be the consequence of the rupture uterus. So we've been seeing. Other reason through operation is that if you're not skillful in doing operation, and that's the reason why we should be careful on in which hospital we go for all those surgical procedures.
Yes.
We've seen a lot. Day before yesterday, a woman came with serious complication because of CS. We are seeing them because we are the referral center. So if I begin to give you instances of people destroying bladder as a result of cesarean section, in fact, it will consume all our time. So surgical procedure can also cause vesicovaginal fistula. Other causes like female genital cutting. You know, we are Africans.
Yeah.
They say they must circumcise a woman.
Yes.
Most of them through circumcision. You know, like I say, those organs, they are aligned anatomically. So while trying to cut the genital, just in the name of cutting the clitoris, some of them will go and destroy the bladder. And the women will not know, they end up with VVF.
VVF.
Other condition that we mentioned here, like I told you, we have a lot of them, a lot.
Okay.
But at least, let me mention the commonest one that we see. The ones that we want to mention here also, there is something we call hysterectomy, cesarean hysterectomy. What does that mean? To remove the whole womb through operation. And I will give us an instance. 3 days ago, a woman, you know, pregnancy should not exist some certain period.
Yeah.
From Makwa, she noticed that her pregnancy is unduly, it's going beyond due date. Then she went to this private hospital. Then the guy counseled her that since your date, EDD has passed, let's just induce you. And the woman, of course, happily agreed. They started the induction, like we mentioned earlier. Maybe they overdosed her with the drug that will cause contraction. Suddenly, she started bleeding. But as God will have it, she delivered the baby. However, even after delivery of the baby, the bleeding never stopped. She kept bleeding. She bled and bled and bled. When they noticed the bleeding would take the life, he called the family, please, let's save this woman. And the only way to save her is to remove the whole uterus, because the womb carry higher proportion of the blood in the body. So, of course, no rational husband wants to see his wife die. He immediately consented, and they went ahead, removed the uterus. But while trying to remove the uterus, the bladder was destroyed. So that was the reason why she was referred to us 3 days ago. So that could be the reason why some women develop fistula.
Okay.
Another reason is traditional practices. Like my sister said earlier, most of the women, they want to boycott writing. They will go to traditional attendants. That's where they want to deliver. And you know, because they are not trained to know the anatomy, some of them, once they see, I mentioned earlier that one of the commonest cause is obstructed labor. So once they see this labor is not progressing, what they usually do is to incise the walls of the vagina. Because they don't know the anatomy, they believe is that if they cut part of the vagina, the birth canal will be expanded and the baby will come out. But while trying to do that, they destroy either the bladder or the rectum that is destroyed behind the uterus. Other causes are cancer of the bladder. Okay. If anybody, a woman that has cancer of the bladder, one of the treatment is radiotherapy.
Okay.
If they go to do radiotherapy, the effect of radiotherapy can destroy the bladder. This one, I think, is also very, very worth mentioning here. Coital injuries. And coital injury is common among child marriage. Okay. When a child that is less than 18 got married and is seeing a man, they're likely going to have a lot of destruction to the private part.
Yes, because these parts are undeveloped.
They are undeveloped. The reproductive part is undeveloped. So they could come down also with vesicovaginal fistula. One of the things that I wrote down here also is penetrating vaginal injury. You'll be wondering, how will this happen? We are seeing them also. About 3 months ago, a Fulani girl in one of the rural environment, she was pregnant, heavily pregnant. And you know, they stay with their cows. So one of the cow also just delivered. And the baby she gave birth before she got pregnant was moving through the cow that just got pregnant. Maybe the cow is aggressive, I guess. So she ran to deliver her baby. Angrily, the cow just used his horn,
I'm pierced.
pierced through the vagina down to the uterus.
This is sad.
So she came down also with vesico, vaginal fistula.
fistula.
The last two I will mention are pelvic fracture. This one is common in road traffic accident. A woman is behind a bike and is driving recklessly. If anything happens, she's likely going to develop fracture to the pelvic. And you know pelvic is the birth canal. So that also could cause vesico-vaginal fistula.
Okay.
Rarely also some infection of female private part can cause
VVF.
VVF. So I think I'll pause here.
All
we
right.
have other causes, but I think let me pause here.
All right. Thank you, doctor, for this explanation. At least we are getting more light about on VVF. Sister Grace, I want to ask, you know, nurses are on the front line of healthcare. They care for women before, during, and even after childbirth. So do you have contact with these pregnant women? So during antenatal, are there ways you could identify women who are likely to have VVF? Apart from all this one he has mentioned, who are likely? Maybe people who are coming in for antenatal and you decide this one is likely to have VVF. Are there ways you can identify it?
Okay, thank you very much. Well, during antenatal, you know, that is the period where all pregnant women get examined.
Yeah.
So from there, through examination, either to the mother, to the baby of the fetus, you can detect some abnormality, especially when the woman is term or due to give birth. But really, if you want to identify women with VVF, it's not really written on them like this woman could have, but you know, age of that woman.
Okay.
For instance, like doctor said that like a child marriage, yes,
yeah.
child marriage, a child of 13 years old being pregnant, you know, looking at this with the age, looking at her with the age, then you will know that this
their organs are not properly developed
enough for the individual to go through birth, to go through labor. So with that, they can have, that's a way of identifying such individual.
Okay, so when you mentioned age, when people, ladies, girls who are underage at the age of 12, 15, 13 comes in, you put them on watch list. That this one, probably maybe her pelvics are undeveloped and they might likely come up with VVF.
Yes.
In the developed world, we have seen girls at this age give birth, and we can hardly hear of VVF. What is the cause? Why is that in the developed world, VVF is like something that is, something that is not...
Yeah, thank you for that question. But before I answer the question, in addition to what our nurse said, other reasons that guide us in knowing that this woman is likely going to come down with VVF. Stature. A short stature is a risk factor. Why? You know, if any height that is less than 1.5 meters, the tendency of delivery is very, very slim. Not that they don't deliver. In fact, I've seen when I was in Jos University Teaching Hospital, I've seen a woman, one of our cleaner, she's less than 1.4, and she has almost 4 or 5 children, all normal deliveries.
Wow.
So they are not hard and fast about this. But one of the risk factors is stature. A short stature woman is likely going to experience obstructed labor.
Okay.
And if there is obstructed labor, maybe if time permits, I'll tell us the pathophysiology. How will obstructed labor lead to fistula?
Yeah.
So possibly I will say that. So a short stature is a risk factor. Other risk factor that I will mention, in addition to what she said, like most of our women, especially we call them multigravidas. Multigravida means a woman that deliver a lot of children, and it's common over there. Don't let me mention the
Please
other
don't.
people.
Please don't.
Some of them, they thought every pregnancy will come the
Come
way
the
other
same.
comes. Honestly, there was one that I usually talk about. She has 7 children. The first baby she delivered at home, second at home, third at home, fourth at home. The 7th one, in fact, she has zero mind and nothing on earth will take her to the hospital. But that was the one that destroyed her. She was in labor for 48 hours with the belief that this one also will come out. So she persisted, though there was obstructed labor. Then the baby died, and yet she couldn't deliver the baby. Then she was referred quickly to MI Ushishi. When she got to MI Ushishi, they noticed the baby is very, very big. We call them macrosomic baby. So the option is that this dead baby, if you should leave the baby in, the baby could cause DIC, and it could kill the mother also. So they counseled them for cesarean section, which they did immediately. However, 5 days after the cesarean section, it was noticed that she was not making urine. So the implication of that statement is that the bladder also has been destroyed. Then she was brought to our center because we are the nephrologists. Anything that has to do with people not making urine, you have to come to IBB for dialysis. So, but the sad story about that is that instead of coming to the hospital to spend 3,000 naira to deliver that baby, the husband sold almost everything because dialysis per section as if it's 15,000. And she needs to have almost 3 sessions every week.
Wow.
And I don't think the husband is earning 45,000 per week. So he sold almost everything, and she wasn't even normal. So that's, if you see a woman that has preference for home delivery, she's likely going to
come
she's
up with
one of the risk factors that our nurses followed. And they will tell, please, madam, each delivery has peculiarity. Because you deliver safely in the first one does not
give you
absolutely guarantee
guaranteed.
safe delivery in the second one. Now back to your question. Like I said earlier, yes, underage does not absolutely say a woman will not deliver.
Okay.
But like I said earlier, not everybody will be fortunate to have. Some of them, the reproductive are not well developed, but they are still delivering. In fact, we were discussing with my wife recently, and she was like, what are these Fulanis eating that underage children kept on delivering safely? You see 13, 14, 15, without any complication. That thing, I think, it's only God that can answer that. But it's, being underage does not really mean that you might not deliver safely.
Okay, thank
But
you.
They are coming down with complications.
All right, thank you, doctor. It is estimated that 3 million women are afflicted worldwide with fistula. And 2 million of these women are living in sub-Saharan Africa and Asia. And sad to note that 1 million of this population of women who are afflicted with obstetric fistula are living in Nigeria. Why is the rate so high in this part of developing country?
Okay, thank you, Ma. I think, well, let me begin by saying one of the shortfalls in Africa generally is that we don't keep record. Why am I referring to that? The figure you quoted, in fact, if I checked a lot of journals before I came. Some journals, in fact, WHO, which is a reliable
statistics,
said that over 20 million people are living with fistula. And higher proportion of that figure, of course,
are undetected.
No, they are in Africa.
Okay.
And Nigeria happens to be the highest. But you know, I will not doubt that. There is this hospital in Jos, Equa Evangelical Hospital. Some of us that are conversant, the present name is Bihan University Teaching Hospital.
Okay.
We have some specialists there that repair this VVF. They also conducted a study recently. In fact, they said every year that Nigeria record 13,000 new cases of fistula, that over 400 to 800,000 women are living with vesicovaginal fistula. You know, like I said, we don't keep record.
Yeah.
So that's the reason why they were given those figures in range. 400 to, but the candid
400.
truth is that, honestly, most of the centers, because we have only few centers that repair VVF, most of the centers that repair VVF repair over 500 to 1,500 annually.
Wow.
So just imagine, just to repair, and more than, far more than half of that number
are waiting for
to
repair.
because there's no
Wow.
space. Higher proportion will not even present in the hospital. So that's the reason why I will not doubt that figure quoted by WHO. So the reason why it's common in Africa, some of the reason is that illiteracy.
Okay.
Illiteracy, and one of the reasons I mentioned earlier, preference for home delivery. They just, in fact, if you see some of the women coming for antenatal, that means there is a pregnancy complication.
Okay.
I've challenged a lot. They will say, why will I come to the hospital? After all, I'm not feeling any problem in my body. So because of that, they will stay at home and go and deliver and come down with a lot of complications. Some of the reasons are this avoidance of CS. And I think this one cut across all ethnic groups.
Okay.
CS is like a taboo to most of us in Africa.
Okay.
I told the woman recently, she came, she was already draining liquor. The water that sustained the baby, that's what we call liquor. It's already coming out and it's very, very dangerous. That is where the baby gets his feeding. That is where the baby gets oxygen. Everything that you could think of, that's where the baby, she's has already draining water for more than 3 days. If that water gets infected, she can die through, it could cause chorioamnitis.
Wow.
So after I scanned her, I noticed not only draining, the water has significantly reduced. The baby is lying in a breech presentation. So I told the woman, we were sitting to each other. I said, Madam, this is the problem. The water has already drained. So it could cause serious problem for your baby. And the baby is not even lying well in the first place. The best option for us, let's session you. The woman fell down. So everybody is running away
From
CS. And that is the reason why they will take some of the women home and go and come down. But in the developed world, in fact, I don't know how true it is. I'm still working on that. I learned that recently, in some developed world, women will come and tell their obstetrician, once I'm 10, I want you to section me. And the reasons are not far-fetched. Somebody that just wants to give birth to one baby, of course. But here you are thinking if you begin with C-section,
It's an abomination.
not even only abomination, ma. You are thinking your babies, if you want 6, 7.
Yes.
So those people prefer to go for, they don't even want to suffer. When I was in med school, higher proportion of my classmates say they want to undergo CS. They don't even want to, because go to labor ward and see how women are true.
You know, most of us hold on to this, that they say they want to deliver like the Hebrew women. They hold on to a lot of religious beliefs, and that makes them to behave that way.
And sorry, to add to what doctor said, you know, the reason why it's most common because of the people living in a rural area that don't have access to
good health care.
Good health care.
Okay.
So it is very difficult for
them to access
health care.
care.
So that's why they will deliver
And
at home
poverty.
poverty.
And
Poverty. Some of them believe if they come to hospital,
They will
they
spend
will
a lot.
begin to spend money. In fact, I asked a woman, she delivered at home recently. She started bleeding. So that was the reason why she came to the hospital. When she came, we asked her to go and get 2 pints of blood because she was already in shock. The husband came out and said, he has 700 naira. And a pint of blood is 6,000. So poverty It's one
Okay.
of the.
All right. Thank you, doctor. There are a lot of myths and misconceptions about VVF. Many see it as a cause. Others perceive it as witchcraft. So, and this also makes people root for traditional help or religious help rather than going to hospital, just like you have mentioned it. And most of these women, because of they see it as a cause, they are being ostracized from their community. And so, what do you, how is VVF a medical condition? Even though you have explained much about on it, but we want to know, just to clear off the air, so that people will understand: is this a medical condition, a cause, or a witchcraft? What it is?
Okay, Mai. Yes, it's a medical condition. And let me just use this medium to explain how it happens in obstructed labor. Like I said, bladder is in front of a woman, the womb is in between, then the rectum is behind. If the head of the baby, like I said, during obstructed labor, there is a bone in front also, we call it pubic bone. It's just in front. The head of the baby will be compressing on that bladder, thereby depriving the bladder of blood supply. Let me give us a very, very typical example. If you see somebody that is unconscious and is lying down for more than 2-3 days, if they just move that person, it will develop bed sores. Because there is no blood supply while lying down. The same thing in VVF. Once the blood supply to the bladder is compromised, the place becomes gangrene and it slough off. Okay. That's the reason why there will be abnormal connection to another organ that is closer to the uterus and is purely a medical condition.
Okay, thank you. Having cleared that, VVF is not a cause, it's a medical condition. All right, what are the challenges being faced by these women suffering from VVF?
Okay, women that have VVF, they go through different kind of challenges, either from the community or the family, such as stigma, for the fact that there is continuous leakage of urine by that woman. So they kind of neglect the woman. They just discriminate her that this woman, in fact, with what we just said now, that is it a cause? Some people, some society believe that this woman is cause. So with that, they kind of neglect her. They don't allow her to do anything that has to do with family. The husband divorced her because of continuous smell, either urine or feces from that woman.
Okay, so she
goes through
shame, stigmatization, abandonment, and the rest of it. Okay, you're talking about abandonment. Doctor, please, divorce is common with patients suffering from fistula. Most of the women affected by obstetric fistula usually come up, encounter immediate divorce. Why? Because some of these survivors, their stories put the male gender in a bad light. Most of them have one song to sing. My husband abandoned me. I was thrown out. I was rejected. And it doesn't put the male gender in a good light. So please, can you quickly tell us why?
Yeah, thank you, Ma. I think if you come across one of a patient that has VVF, you understand the reason why they pass through those kind of challenges. Yes. They look so miserable, unkept, smelling. In fact, the last one I saw, she came from a village also. The husband, in fact, he has left her. Then the family had to bring her to Mina before the VVF was repaired. So, not only the husband, nobody want to move closer to them because they are badly smelling. So they look very, very unkept because of that.
So because of that, the husband should abandon them or reject them.
I think it's one
because
of them.
you're trying to protect your male gender. And we, the women, we are not happy with it because we know that marriage is for better for us. And my sister, you agree with me? Yes. If this ailment is a male disease,
of course, the
condition.
woman will not
You know what
abandon
we
the
women
man.
will do?
Of course.
We will nurture
We'll
them,
be by
even
their
nurture
side.
the fistula, package it for them to come out of it. Eh? So please, doctor, try to be rational in this place. Okay, thank you so much this evening for joining us. We all know that our good health is our most precious gift from God. And our good health is when our body is functioning as it was designed to function. That is our kidney, our liver, our bladder, our lungs, are all these organs performing their function. But when these organs malfunctions, it affects our lifestyle. So it is with women living with fistula. Many of these women have their normal life until they experience childbirth injury, which make them to become the way they are. So we should not stigmatize these women or shame them. Rather, we should show them support, empathy, and not rejection and stigmatization. Thank you so much for joining us. We appreciate you. Stay with us next week.